Hi, I'm Jules Hammond, and I'm going to take you through this short presentation on the last 3 years of stepping into nature. So over the next few slides, we're going to look at have we done what we said we would? We're going to then look at are we making a difference, and we're going to finish off with some suggestions around can we do it better. Okay, so I'm just going to take you over a few headlines of what we've done. I'm not going to go through all of these. We had 827 individual people register for Stepping into Nature, and that generated over 2,500 places filled on our activities. We have data on 374 of the 474 activities delivered, and that generated around over 1,000 feedback forms. And we can see a lot of things from the feedback forms. We had around 37% repeat attendance over the 3 years, and 47% of those actually were previously low contact with nature. So we've enabled them to actually engage with nature a lot more. So part of the Stepping into Nature is the community small grant schemes, and we've had 19 community grants over the last 3 years. 6 of those have actually been to kickstart an activity. So to kickstart either a new initiative or an activity where it wants to be more inclusive. And majority of these are actually gone on to actually continue or widen out. 4 have been around buying new equipment to be able to deliver activities, and 9 of them has been helping with infrastructure or access improvements that is enabling people to use those sites to deliver inclusive activities or inclusive areas where people can go. So over the last 3 years, we've been growing our message, and we've done a lot of collaborative work in between the environment and the health sector. We've been linking people up, and we've been looking at how people can include inclusive nature-based activities in their daily work. We've been working with Public Health Dorset on our evaluation training, on our evaluation framework, and we've been able to share that out and open it up to other providers and other people, which has enabled them to be upskilled around evaluation qualitative methods. We've engaged with around 9,000 people through events, workshops and talks. And all of our providers inside and outside of the project have actually had dementia awareness training, including all frontline staff and volunteers. So, are we making a difference? Well, we feel that SIN has made a difference over the last 3 years, and I've just picked out some pointers here. SIN has provided various activities across Dorset, which has maximised the opportunities for people to connect to nature. Our participants have spent more time in nature and more socially connected. Our work with the health sector has made them more aware of nature-based interventions for well-being. Providers have become more inclusive and more confident. And 78% of providers that have been involved in SIN have said that it's changed the way that they do things outside the project. So they're looking at the way that they deliver activities, their sites, their signage to become more inclusive and more dementia friendly. But can we do it better? So over the next 3 years, we want to continue to build on the effective model that we've created to increase that co-working between the environment and the health sector. We want to build on the community relationship and look at how we can actually integrate our activities within communities. We want to grow the partnership and have that shared vision of enabling people to get out for well-being into the countryside. And we're going to share our skills and learning and continue to share our skills and learning. And we're always looking for new initiatives to help people face barriers to engage the natural landscape for well-being, and we'll continue to do that over the next 3 years. So I just want to finish off with a special thanks to the people here that have actually been part of the project itself, including obviously the National Community Lottery for taking the leap of faith and funding us. And to let you all know that there will be a full evaluation report on our website in the next few weeks that you can download, and actually goes into a lot more detail about what we've done and the evidence that we've found. And thank you for listening.